Hello, hello, hello. Good evening, students. Good evening. Am I visible to all? Am I audible to all? Can all of you hear me? Can all of you see me? Yes. Okay. Thank you very much. Can somebody please come put in the chat? Hello, hello. Good evening, students. Good evening. Am I? Yes. Yes. Hello. Yes. Thank you. Thank you. The South Monks. Yes. Very good. Okay. Good evening. Yes. Good afternoon. Good evening. Yes. Okay. Perfect. Okay. So welcome all of you to our recall. And can somebody please also one or two more students also put in the superb. Okay, so welcome all of you to our recall of the FMG examination which was conducted on Sunday, and thank you for so many messages. I will show you so many students have messaged me that sir, each and every MCQ in your lecture series helped us, and each and every MCQ in my paper was from your video lectures. Yes or no, thumbs up if you agree with me also. Okay, and feel free to get in touch with me on phone and WhatsApp on this number. And do not forget, just take 10 seconds time. Of course, you are a subscriber of the NLC channel, so subscribe to the NLC channel also, but quickly take 10 seconds time and please start following me on Insta, where a lot of interesting content I put regarding your exams. And please subscribe to my YouTube channel. Thank you, the South Monks. Notes already. Yes. Okay, please subscribe to my YouTube channel also, where a lot of interesting content and the recall videos and lots of things we post over. So just take 10 seconds. Of course, you are a subscriber of NLC, but just do this and quickly take 10 seconds and do this. Okay, and also do not forget to download the OG Guru app, whichever is your future preparatory examination. 6 months OBGY masterclass available. Republic Day sale is on, and download the OG Guru app from this link, and just in 1500 rupees the entire OBGY lectures is what you are going to get. So now let us begin, and just is what I wanted to show you. As you can see, sir, I felt very how to approach the question. OBGY questions were very helpful, sir. मेरा exam बहुत अच्छा हुआ था. All these things, okay. OG Guru really helped me, and sir, the courses which were helped, and sir, all this you can see, and so many messages I am receiving from the students, and thank you very much for your appreciation and love. Okay, so let us begin. Okay, these are the recall questions. As I said, we're going to be very quick in giving you the answers and the discussions, and जो भी आपके पेपर में कुछ अलग था, you are feel free to tell me कि सर ये नहीं था, ऐसा था. We can also obviously, as I said, come up with a final refined answer also. Okay, so first question, I'm sure all of you must have got it correct. क्या था आपका answer? I'm sure all of you must have got it correct. Okay, sir, this is what, sir? Multiple small follicles arranged in the periphery of the ovary, and this is lady with irregular cycles. I'm sure सबका correct हुआ होगा. Polycystic ovarian syndrome. Yes or no? Okay, what this is your necklace pattern. Okay, necklace of pearl pattern, necklace of pearl pattern, or string of pearls. Very good. Okay, yes. Okay, so this is necklace of pearl pattern or string of pearls, and I'm sure सबका correct हुआ होगा. Okay, is it clear to all of you? Yes, moving on to the next MCQ. Again, you can see in this picture, again, this is a repeat question. In the previous year, the question has come, but the image was there for the first time. This you can see is a bluish discoloration of the cervix as well as the vagina also. And this is given by two names, Shadwick sign. Another name is Jacquemer sign. Okay, so Shadwick sign or Jacquemer sign is the answer over here. Goodell sign is the cervix becoming soft, that I have to feel it. Hagar sign is on bimanual approximation of the fingers is there. And Osiander sign is what? The pulsations in the lateral fornix. Okay, pulsations which you feel. Okay, pulsations in the lateral fornix. Okay, so I'm trying to give you knowledge also apart from the answers, so that for your upcoming exam also it is going to be helpful to you. Overall, as you know, OBGY is the single most important subject. 30 to 35 questions definitely come every year. This year also we had around 30 questions. Moving on, what is this? Yes, I'm so happy. I had predicted that primary amenorrhea topic you have to know. Breast is well developed and absent uterus. Okay, so all of you look on the board. Sir, whenever we have primary amenorrhea with absent uterus, what are the two things we have to keep in mind? Anybody? Primary amenorrhea, absent uterus. तो कौन सा दो चीज देखना है? Yes sir, RMKH and androgen insensitivity syndrome are the two main things to be kept in mind. And we know over here the gonads presents are ovaries, and here gonad presents are testes. Apart from the karyotype, what we also need to look at is the axillary and pubic hair, and here axillary and pubic hair I am writing AX. Okay, axillary and pubic hair is going to be well developed over here. Here it is going to be absent, or sometimes to make the paper difficult they will use the word sparse, which was over here. So clearly you can see this was the question, no uterus, no ovary, so it is not RMKH. And all of you know, yes or no, Turner's syndrome. Yes, testosterone level was in the male range also, some students told me yes. So this is androgen insensitivity syndrome. Yes, I want all of you to participate. Okay, the South monks and the benzoid, उसके अलावा बाकी सारे भी students है, please all of you answer. Turner syndrome में क्या होता है? Sir, Turner syndrome में the uterus is present. Is this understood to all of you? I repeat, Turner syndrome में uterus छोटा होता है, चिंटू होता है, hypoplastic होता है, but yes, the uterus is present, it is not absent uterus. Okay, and yes, you are correct. Some of the students also told me कि sir ये भी था कि the testosterone is a normal male range. Okay, so androgen insensitivity because there is sparse axillary and pubic hair. Very good. Moving on, again very simple MCQ. I had shown you this. What is the typical snowstorm appearance? This is the snowstorm appearance. Passage of grapes like vesicle itself is good enough to tell you the answer. HCG भी बहुत high है, and this is your complete vesicular mole. You will see कि sir क्या होता है कि sir inside the uterus multiple fluid filled grapes like vesicle. There's one more MCQ. Okay, what is partial mole? Sir, why is it not a partial mole? Sir, partial mole में baby भी है. Partial mole is some fetal parts are there, so baby is playing with the snowstorm. Okay, baby भी है, snowstorm appearance भी है. Okay, so when you see some fetal parts along with the snowstorm, this is only our snowstorm appearance. Is this understood to all of you? So complete snowstorm appearance, complete vesicular mole. Yes or no? Again, a very important concept MCQ. When the lady has reached post-menopause, I start my lecture with this, if you all of you agree, master and servant relationship. So sir, when the ovarian function, post-menopause matlab sir, ovarian function is finished, from the pituitary, the master will shout more loudly and FSH keeps on increasing. Of course, LH will also increase. Is this understood to all of you? Yes. And however, from the ovary, because ovary has stopped functioning, so estrogen is also going to be less and progesterone is also going to be less. Do you agree with me? तो क्या है हमारा answer? Yes, progesterone will not be high. Okay, is it clear to all of you? FSH high, very good. LH also high, estrogen low, and progesterone also low. Is this understood to all of you? So whatever is from the pituitary is going to be high and whatever from the ovary is going to be low. Is this understood to all of you? So this is the hormonal change which you see, and estrogen low, progesterone low, FSH is going to be on the higher side. Very very important, virgin difficult MCQ tha ye, and all of you please pay attention. The clue is that there is dysmenorrhea and bleeding per rectum whenever she has her periods, anything connected to periods. And this is the endometriosis of the rectum. Okay, please understand this, rectal endometriosis. That means what? Please, you can similarly get next, they can give you bladder. Okay, so this is blood in stools, cyclical. Okay, cyclical hematochezia. Okay, so blood in stools, as you know, she is having that, sir, when bleeding per rectum occurs or during passage of during menses or whatever. So cyclical changes. So sometimes if there is bladder, I'm just giving you example. Suppose there is a urinary bladder. This is a urinary bladder and there is an endometriotic nodule. Then that time also it can happen. Because sir, if there is a bladder, I'm giving you for the next year. So sir, then there could be cyclical hematuria. Hematuria can happen if it's a bladder endometriosis. Okay, so similarly, very good sir. Okay sir, when there is endometriosis of the rectum and that's a nodule felt on per rectal examination bhi, some students told me ke diya tha. So if it's any extra genital endometriosis where there is anything in relation to her periods. This is endometriosis. I'm sure all of you must have got it correct. Yes, the simplest stuff. We are not supposed to induce labor in a complete vesicular mole, because if you induce labor, the uterus will contract and there will be retained product. So suction evacuation has to be done. What's the weeks of gestation given over here? यहाँ पे weeks दिया था. How many weeks the patient is? 10, 12, 14 weeks. Okay, whatever may be the weeks, remember ke whatever may be the weeks of gestation, whatever may be the weeks of gestation given to you in the question paper, let it be 14, let it be 20, let it be 28, let it be 36. Whatever may be the weeks of gestation, we have to cyclical, yes, okay, yes, that is going to be suction evacuation. Suction evacuation, irrespective of the weeks of gestation. Is this understood to all of you? Yes, very, very happy. I have told you that the normal cervix on USG is T-shaped. Again, from the history, USG image just given to extra confuse the student. Second trimester patient is there, gravida 3 abortion to matlab previous 2 abortions and previous 2 losses in the second trimester. And here you can see, okay, sir, the cervix funneling. You can see the cervix is slightly open, Y shape. Okay, this is a Y shaped cervix. Y jaisa dikh raha, that means it has opened up. Normally, when the cervix is closed, okay, whenever the cervix is closed, it looks like letter T. Okay, it looks like letter T. Okay, so cervix is closed, it looks like letter T, which is normal. Okay, so here, sir, there is a funneling. You can see, sir, from upper part you can clearly see the Y, same thing what we have shown you. So this is cervical incompetence. Yes, I'm sure all of you. Marks on the cervix, the same thing. The marks on the cervix must have been given to make you easier in the question paper. The same marks like what I've shown you. Okay, this is, you can see, sir, upper part. So this is cervix. You have to imagine this is cervix. This is the fetal. This is the liquor around the baby. Okay, this is the fluid level, and you can clearly see I have drawn a Y. I have drawn a shadow like this, looking like letter Y. Okay, you just have to rotate the image in your head. Just rotate the image like this. You will see that there is a Y-shaped thing. Okay, Y. That means it is incompetent cervix, and that is cervical incompetence. Okay, very, very easy. बहुत बार हमने डिस्कस किया था कि what is the contraindication for methotrexate in unruptured ectopic. So of course patient should be stable. Patient should be stable. Sac size should be less than 4 centimeter. Up to anything level, let it be 2000, 3000, 2K, 3K, 4K, anything less than 5000 is okay. And this is the answer. Okay, sir, when fetal cardiac activity is present, when fetal cardiac activity is present, the methotrexate success is lesser, and therefore presence of a fetal cardiac activity becomes a contraindication for the use of methotrexate. Okay, we have, is it understood to all of you? So less than 5000, okay, level given was 2000. Okay, yes, perfectly correct. Okay, moving on. Again, बहुत simple था. I've told you, sir, if a hypertensive lady has come to you, of course barrier can be given. Copper T also no problem. LNGIUS is our Mirena, can also be, because it's going to release the hormone locally. Yes, sir, OC pills are to be avoided in patients who have got severe hypertension, and also just one more thing, remember, in the future, severe diabetes also. So we've got hypertension, diabetes patients, or DVT, thrombosis, stroke, all of you know that we will be avoiding OC pills. Okay, is this understood to all of you? Again, a very nice question. Okay, when the patient, I'm not sure, I've got only 3 options: salpingotomy, salpingectomy. 4th option kya tha, somebody can tell me. But basically, when you don't want any future pregnancy, then today what do we do? Sir, we don't do a salpingectomy. You don't directly cut the tube. Yes, modified Pomeroy's method. Okay, so the loop of the fallopian tube is there. The fallopian tube, we make a loop of the tube and we only cut it, and only this much part is done. So it's called as tubectomy. Okay, it's called as a tubectomy surgery or modified Pomeroy's technique. We do the loop of the tube is created and this loop of the tube is cut. Okay, so we tie a knot over here and we cut this loop of the tube. And this is Pomeroy's technique is when you open up the abdomen. So I open up the abdomen and I do a laparotomy. We do a laparotomy. And nowadays we also do the same thing through laparoscopy. If you recollect in my lectures I have shown you silastic bands, chote rubber bands are there, which is to band the tube. That is through laparoscopy. Okay, so in laparoscopy we use silastic bands. Silastic bands are used to perform the tubal ligation surgery. Is this understood? Yes. Again remember, okay, here this is hardly ever done nowadays, but this is the baby is in transverse lie. So sir, the baby is in transverse lie. We are putting the hand inside the uterus and rotating it and converting it to breech, and then we do the breech extraction. So what is this OG in the, this is sir internal podalic version, yes or no? And this, my dear students, as I said, I always tell you, it's almost like outdated kachra dustbin. ये नहीं करते हैं except when, sir, when it's a case of a twin pregnancy and if the second baby is in transverse lie, then you can try this just to avoid a cesarean. Okay, remember, what will I do? The first baby is transverse, what do I do? Chalo, tell me in the chat box. Comment in the chat box कि अगर first baby ही transverse lie है, if the first baby is in transverse lie in a twin, if I have a twin and the first baby is in transverse lie, then what do I do? Then sir, I do LSCS only. Is this understood to all of you? Yes. So delivery of the second twin in transverse lie, this can be tried. This can be tried. Is this clear to all of you? Yes. Beta no. Aman Jaiswal nahi beta. In twins, agar twins mein first baby is in in labor. Okay. In it's first baby in transverse lie, there is no mecha. You don't do and you have to go for LSCS only. Okay. If it's twins, if it's normal singleton, yes, you can try. In twins, you can't do external version. Okay. Is it clear? Aman Jaiswal, समझ में आ गया बेटा? Yes. Now this again, remember, I have got different answers. I have got different answers. What was the type of deceleration? Again, a tough MCQ. It was definitely not mirror image. Many students make it mirror image. What is the meaning of mirror image? You can see over here, this is a CTG, which is a mirror image. Mirror image means, sir, all of you look on the board. Okay, sir, the contraction starts, heart rate starts to go down. Contraction over, heart rate is also recovered. So you can see that they are exactly mirroring each other. जैसा contraction up हो रहा है, यहाँ पे heart rate down हो रहा है. Okay, exactly that is happening. So, but that was not the case. That is what students have told me. Okay, sir, exact mirror image नहीं था. This is the peak. The peak of the contraction is the lowest point. It's called nadir. Okay. Lowest point is called the nadir. Okay. Okay, so what was there in the paper, you will have to tell me. And here, sir, the contraction के बाद, sir, you can see over here, sir, the contraction has already started, contraction is already over, and then the heart rate is dropping down afterwards. Okay, so heart rate starts. So that is your late deceleration. You can see again over here, okay, sir, this is the contraction. Sir, once the contraction is over, then the heart rate is dropping down and the heart rate is then recovering well after the contraction is over. Okay, so here basically the dip in the heart rate is coming after the contraction, and therefore late deceleration is the answer. Some students told me, sir, it was variable pattern. Variable may, it is anytime, like it is not related to this is the contraction. Variable means what? So contraction can be before also, with also, after also. There is no fixed pattern. Okay, so you will have to tell me, students, के आपको एग्जाम में क्या लगा था. If it is afterwards, you mark it as late. Variable में it is not related to this, but early तो नहीं था. Okay, early तो student ने कहा कि sir early तो नहीं था. Okay, so was it variable pattern? Like was it any time with the contraction? Not relation to contraction, it is a variable pattern. So this is again a tough question where the types of deceleration was asked. Normally we just tell you when do you see which deceleration. The actual picture was shown to. So it was a tough MCQ. Okay. Yes. Now here also very important, sir, when HbA1 level C is very high, HbA1c, then the patient can land up with abortion and miscarriage. So I will increase the insulin dose, reduce the HbA1c level, and then only plan the conception. Is it clear? You can't tell the patient to conceive and then you will increase the dose. No, first the HbA1c level should come down to normal. Okay, that should be the target. Crystal clear to all of you? Yes, again a nice MCQ ke suddenly on doing a ARM, suddenly sir the ARM is done in a patient. It's actually ARM should not be done. The head is unengaged. How do I know that the head is floating? Sir, because it is 5/5 palpable, matlab completely palpable fetal head. So sir, when the fetal head is completely palpable per abdomen, that means head abhi bhi upar jhool raha hai. Okay, and when you rupture the membrane, the umbilical cord can come out and that leads to sudden fetal bradycardia, and that is your acute severe fetal distress. So never ever, when it's a floating head, also when the head is floating, you have to make sure that you are using a, what do you call it? You are very careful and you don't do ARM, and after ARM we always check there is a cord prolapse or not. Yes or no? Is it clear to all of you? Yes. Now this was slightly again not a tough question, but yes, please understand यहाँ पे एक word कि sir the pap smear was abnormal अगर खाली दिया होता. If the pap is abnormal, okay, if the pap is showing dysplasia or pap is showing abnormality, I would have done both cervical biopsy and colposcopy because pap is abnormal. But here, by the way, on the pap smear, they found atypical glandular cells. Okay, so glandular cells comes from the uterus. Okay, that is the logic. So sir, since the pap is abnormal, cervical cancer तो screening करना भी है. This glandular cells which are atypical, I would want to rule out any endometrial cancer also based on the pap report. Is this understood? So a tough MCQ, and therefore endometrial biopsy along with cervical biopsy. Cervical biopsy करना है. Cervical biopsy, that is your endocervical biopsy or cervical biopsy, but endometrial biopsy should also be done. Is this understood to all of you? Because it's not only अगर खाली दिया होता कि pap is showing dysplasia, yes, that is fine, but pap is showing atypical glandular cells. Okay, yes or no? Glandular cells दिया था. Okay, I'm sure very simple, सबका करेक्ट हुआ होगा. आपके पैथो के टीचर ने भी आपको ये पिक्चर दिखाया होगा. We are seeing hemosidrin deposits when you cut surface of the uterus. You can see over here heavy menstrual bleeding in a parous patient. Generally parous होता है. Okay, and diffusely enlarged uterus. What is the answer? Anybody? क्या है आंसर? आंसर क्या है? Yes, yes, yes. And what is it? Also dysmenorrhea. This is adenomyosis. Is this understood to all of you? Okay, adenomyosis. Okay, yes. All of you please answer so that we can have a yes. Again, very simple micro and OBGY combination, sir. Curdy white discharge. So candidiasis, candid fungal infection, and we get pseudo-hyphae and spores. Pseudo-hyphae and spores. Clue cells are seen in bacterial vaginosis. Okay, yes, Johnson. Oh, yes. नहीं बेटा clue cell नहीं. हाँ, previous वाले में आप you are saying A for which one? Yes, A for the adenomyosis. Yes. Yes, very good. Okay, here we are getting pseudo-hyphae and spores, which is feature of candid fungal infection, curdy white discharge. Okay, now again a very longish clinical question. If you recollect, we have discussed it in our lecture. The patient is dilated and posterior fontanelle या occiput is at around 4 o'clock. Okay, 4 o'clock, that means posteriorly. Okay, and sagittal suture in the oblique. In deep transverse arrest में क्या होता है? occiput is transverse. Occiput will be transverse. That means either, sir, the occiput will be at 3 o'clock or 6 o'clock. Okay, when the occiput is at 3 o'clock or 6 o'clock. So, sir, suppose if this is the pelvis, anteriorly you have got the pubic symphysis, posteriorly I have got the sacrum. Okay, and suppose if inside this I draw the fetal head, we draw the fetal head, this is the fetal head. Okay, so sir, suppose if here is the occiput, they tell you is at 9 o'clock or 3 o'clock, occiput, then you could, and if it is fully dilated, deep transverse arrest means patient is fully dilated at station 0, then it would have been a deep transverse arrest. Is this understood to all of you? Yahan pe it is occipito-posterior position, because occiput they have said is at around 4 o'clock. Okay, is it clear? And the sagittal suture is in the oblique plane, ऐसा भी दिया है. Okay, so basically it is oblique, so it is occiput is more towards the sacrum, this is occipito-posterior. If they tell you here, it could be ROP, LOP. Okay, so occiput could be over here also. Okay, is it clear to all of you? So basically wherever is the occiput at the beginning of the labor, उसके ऊपर से हम discuss कर. So in this question paper they said occiput is at 4 o'clock and the sagittal suture is running like this. Okay, isn't it? So that is it. Okay, so occiput is posterior at 4 o'clock. So this is OP. In brow, we feel the supraorbital ridges. Very important, difficult MCQ. ये भी याद रखना कि सब brow में supraorbital ridges are palpable. Clear to all of you? Again, so many times we have taught you this, कि when the lady is postmenopausal and the endometrial thinking, okay, then we have to do endometrial biopsy. Endometrial biopsy, why? I want to rule out endometrial cancer. Is it clear to all of you? So endometrial biopsy is there. Endometrial thickness is 8 millimeter was given. Okay, in a postmenopausal lady, the endometrium thickness should always be less than 4 millimeter. Yes or no? Thank you, Top Legacy. Okay, yes. Again, very simple. You can see a fungating growth. Okay, so you can see when the lady is having postmenopausal bleeding and its obese patient was given diabetic, obesity diabetic, then this is endometrial cancer. Okay, basically it is something like this. Okay, sir, this is the growth. There's a fungating growth inside the uterus and protruding into the walls. Okay, so you can see over here, and besides you can see we have removed the tube uterus over, such a completely panhysterectomy specimen. Okay, so endometrial cancer was this answer. Okay, this is again a very nice, actually a question nahi putna because it's a misconception. Okay, that papaya and pineapple, that's why पुराने but ऐसा कुछ नहीं है कि सर papaya pineapple can lead to abortion and miscarriage, जैसे वो गरम लगता है fruit, ऐसा कुछ नहीं, कचरा dustbin, wrong concept. Okay, the answer is papaya pineapple, but as you know it's a misconception that it can lead to a miscarriage. Okay, so the answer is this. Okay, all fruits are safe, patient can eat fruits, vegetarian, non-vegetarian food, all is okay, there's no restriction of any fruits. Okay, clear from all of you? Again, as I said, this is a pediatric question. Only 13-year-old girl has come and asymmetrical breast development. You just have to tell her not to panic. There is no need to do mammography and all that. Just reassure and reassess the patient, because thoda sa starting mein breast asymmetrical ho sakta hai. As she will grow, the both sizes will almost be equal. Okay, so breast asymmetry in a young girl, we don't do anything. Okay. This again, so the questions were longer, but the concept is same. That's why in the third trimester or even in the second trimester, why would the patient feel giddy and dizzy and the blood pressure is low? Yes, sir, because in pregnancy, the cardiac output rises, plasma volume also increases, but the peripheral vascular resistance is decreased. Okay, and therefore also there is a similar concept, because the gravid uterus compresses the IVC, and that's why you can get supine hypotension also. Okay, so few years back supine hypotension ka tha कि on lying down and on changing position there is a drop in the blood pressure, supine hypotension. That is also similar concept. Okay, so here sir, decrease in the peripheral vascular resistance. Clear to all of you? Yes or no? चलो इसमें क्या मार्क किया था, इसमें और क्या ऑप्शंस था? व्हेन देयर इज IUFD टू सप्रेस, ओके वी नो के सर प्रोलैक्टिन, ऑक्सीटोसिन इज नॉट गिवन. Oxytocin is given with is breast engorgement. You want to pump out the blood. Okay, bromocryptin या cabergoline. Bromocryptin या cabergoline both are okay, but cabergoline was not in the option, and therefore bromocryptin was the answer. So bromocryptin is given for lactation suppression in a lady, not misoprostol. Okay, is it clear to all of you? Yes or no? Yes. क्या क्या ऑप्शंस थे आपके पेपर में? एंड दिस इज यस. नाउ ऑब्वियसली दिस साइन वाज नॉट गिवन टू यू, दिस एरो मार्क विल नॉट बी गिवन टू यू, बट ये क्या था? एनीबडी? सो यू कैन सी सर, वन बेबी इज ओवर हियर, वन बेबी इज ओवर हियर, एंड द प्लासेंटा. सो सर दिस मेम्ब्रेन गोज लाइक दिस and this membrane goes like this. Yes or no? Somebody told me कि सर Y जैसा कुछ दिख रहा था. Okay, and placenta, you can see कि सर placenta runs for some distance. OG in the chat box, अगर मजा आ गया पेपर देख के. Everybody has told me कि सर among all 19 subjects best हमारा performance OBGY में हुआ था. Yes or no? Do you agree with me? Okay, and you can clearly see the placenta is running in between. This is seen in DCDA, dichorionic diamniotic twin pregnancy, which is the answer over here. Dichorion diamnion. Okay, दूसरे में क्या दिखता है सर? इन अ मोनोकोरियोनिक डायएमनियोटिक व्हाट डू वी सी सर? वी सी अ T sign or a inverted T sign. So this is our lambda sign or the twin peak sign as we call it on ultrasonography. Okay, and again this was a superb question. This question in fact had image come few years back. Okay sir, whenever there is a polyp, the polyp has a blood vessel on it, which is the feeding vessel sign. Feeding vessel sign, which was told to you कि we have a lady who has, in fact diagnosis दे दिया था कि diagnosis of endometrial polyp. Yes or no? Was the diagnosis given to you or only directly दिया था कि some mass in the uterus and feeding vessel sign is positive? Feeding vessel sign is suggestive of a polyp, endometrial polyp. And what do you do? Future में also I can show you, okay, कि this is a endometrial polyp. This is a hysteroscopy view. Okay, this image was not shown. I'm just showing you extra information. So hysteroscopy view is there. This is the polyp, and what we do, so through the hysteroscopic route we will cut the polyp. Okay, and therefore we don't do a laparoscopic polypectomy. Okay, not from laparoscope. And we directly don't put in a LNGIUS that you may want to put in, and directly don't do a hysterectomy. We will go for hysteroscopic polypectomy and her problem can get solved. Is this understood to all of you? Okay, so that is the feeding vessel sign which you see on color Doppler on ultrasonography. I think there was one more MCQ which was, I think that sir, when the lady, so these are all the 28 to 30 questions. The purpose of this was a quick recall session. We have not given the explanation I have given you. There was one more last question which somebody told me, sir, LNGIUS is inserted, LNG intrauterine device has been inserted and patient is having some spotting. Okay, so again it is understood, you have to counsel the patient because starting में progesterone takes time. So initially patients do get spotting and you just have to wait and watch or reassure the patient because the spotting will stop as the action of Mirena will take over, and majority patients do land up in only complete amenorrhea. So this is also on the question, sir, LNG IUD patient is having spotting. Yes, very good, Robin Mishra. So I would say wait and watch, or just reassure the patient everything is okay, it is known to happen. Okay, so thank you. And that was our paper. Overall my assessment was that yes, the paper was slightly on the difficult side, but all my students, you can see completely beautiful handwritten notes which you will get. And please download the OG Guru app. And those who are preparing for the NEET PG also, if your FMG paper has gone super, and all those who are preparing for the NEET PG can enroll and suppose your FMG target, because many next year students also see the recall. So if your FMG is in the month of June or July or next January, then quickly download the OG Guru app. I'm personally guiding all the students how to study, how to prepare. You can get in touch with me on phone and WhatsApp on this number, and just in 1500 rupees you can enroll in the master class. Download the app and I will be there as your mentor throughout. Okay, and of course we'll be seeing you in the NLC lectures also. I'll be taking the lectures for NLC classes also. Okay, so thank you very much. Yes, thank you Robin. So many questions came. Thank you. I know that so many that's I showed each and every student has told me, okay sir, so many questions were there from your rapid revision and OG booster course and all the courses which we had taken. Okay, when the live classes. Okay, so quickly take 10 seconds time, student, and just please follow me on Insta and also follow us on YouTube channel. Of course you are subscribers of NLC channel, but do this also and follow me on Insta and on YouTube also. Okay, so thank you NLC channel. Thank you Ashish sir for having me over here, and I will be seeing you very soon. And to download the OG Guru app, and I'm always available on phone and WhatsApp on this number. So overall there were 30 questions. OBGY is the single most important subject. You cannot neglect it. Do very well in OBGY and you can score very nicely. Okay, so bye bye, best of luck, and thank you very much. And get in touch with me on phone and WhatsApp on the number mentioned for any help and guidance which you need. Thank you very much.